Guys, welcome back to my channel. I am Zindi, your pharmacist, and this is Health Talk TT. Now, so far in the COVID series, I've been covering comorbidities. Comorbidities is just a big word for one or more, the presence of one or more condition in the same person. So when I'm speaking about hypertension and persons with COVID, diabetes and persons with COVID, and today I want to move on to asthma. Now, asthma is a huge topic. Today I'm literally just scratching the surface of asthma, but if you all want me to answer more questions or have specific aspects of asthma that you want me to go deeper in, please just leave a comment below the video, or you can email me at healthtalktt@gmail.com. Right, so today we're dealing with asthma. I'm going to talk a little bit about the condition, a little bit of some of the risk involved with asthma, and I'm going to speak about triggers. What I've realized in practice, some persons are not even aware of the idea of triggers as it pertains to their asthma. I remember having one customer come into the retail pharmacy setting, and she came to repurchase her inhaler. And I asked her, okay, so do you know what your triggers are? And she had no idea. Never even heard about triggers in association to asthma. So I know that there's a need to share the information, and I really do hope that I'm able to do so within the short time that I have in this video. Okay, let's begin. So asthma is one of the most common chronic diseases that we deal with. It is predominantly a respiratory disease. Now, the actual cause, like a specific pinpoint cause of asthma, is still not yet known or clarified, right? We don't know exactly what is the specific thing that causes it. However, there are stimuli or triggers, and I will get a little bit deeper into triggers as we go on along the video. There are stimuli or triggers that could result in bronchoconstriction. And bronchoconstriction, I know it's a big word, but it just means that the air going through your bronchioles that allows you to breathe, it allows your lungs to operate the way it's supposed to, is restricted, because constriction means just the narrowing of the vessel. So when you get that tightness on your chest, the shortness of breath, the having to wake up during the night with difficulty to breathe, what that happening is the bronchoconstriction that results in what we commonly call an asthma attack. So we know that there are things that could cause it, triggers that could result in an asthma attack. But let it be known that for persistent and severe attacks of asthma, it's usually inflammation that is predominantly responsible for that. And that's why some of you all are on anti-inflammatories like prednisolone. Right? So that's what asthma is. Moving on to the 3 symptoms I want you to pay attention to during this COVID-19 time. Now, a cough is associated with the COVID-19. It's one of the symptoms of it. And for you as a patient who has asthma, that's a symptom that you should pay attention to, because excessive coughing can exacerbate an asthma attack. I remember, now asthma is close to me because I grew up in a home with my eldest sister having had asthma. My grandma also had asthma, and so I understand the urgency of dealing and managing the disease state. And when I speak from the experience of having seen my sister go through it. I would have been very small at a point in time, but seeing my parents, frantic, having to run to the hospital or having to use a nebulizer. So I do understand the extent or the danger that is associated with asthma. So the symptom 1 is cough. 2, and the corona cough is usually a dry cough. 2 is the stuffy nose, although stuffy nose is not a very common symptom of coronavirus. There are cases where persons have been reported with stuffy nose, and of course stuffy nose would result in difficulty to breathe, and also the shortness of breath. Shortness of breath is one of the more common ones, but it is not associated with any other respiratory disease that is going around right now, like the flu or the cold or seasonal allergies. None of those would cause a shortness of breath. So in the event that you're experiencing a shortness of breath, it's either you're getting an asthma attack or it's a symptom of the coronavirus, right? So those are the three symptoms. I mean, there are more symptoms for coronavirus, but for an asthma patient, these are the three symptoms that should wave a red flag for you. And there are the risks that I want to explain. So I know initially what was released based on research done on US based patients was that persons who had asthma were more at risk for hospitalization, meaning you got the virus and you were more at risk for having to go to the hospital, not stay home and manage it with over the counter meds, but you would have had to go to the hospital. According to the World Health Organization and Center for Disease Control, which would be CDC, asthma patients are still on the high risk list. And I do not want you all to assume that once you have your rescue inhaler, which would be a salbutamol, your ventilator inhaler, that you will be fine. Actually, it's the complete opposite, right? So the precaution that I want to drive home to you all is whenever there is some respiratory disease within the community, whether it's a flu, it's a cold, it's Sahara dust that's causing your allergies, as an asthma patient, you should be on your top game in preventing an asthma attack. Making sure you have your medications at home, making sure that you are adherent to using your medication. And it's the same measures you will take during that time. It is the same measures that I would recommend during this time. Make sure you have your medication, you're taking it, you are staying at home, you're avoiding your triggers. Now, the two key points that I want to drive home, if nothing else you remember at the end of this video. Two key points: patient adherence and know your triggers. Those two things could really determine how well your asthma is managed at home during this time. So patient adherence is you taking your medication prescribed for the time it has been prescribed for. It's called patient adherence or patient compliance. And knowing your triggers. So there are three major groups. They could be environmental, drug or chemical, or it could even be a condition or event that could result to an asthma attack. Environmental could be pollen, it could be the Sahara dust, it could be mold, it could be AC, probably AC causes your exacerbation, it could be tobacco smoke, it could even be cockroaches. Yes, you have heard me correctly. Cockroaches, those little nasty insects, could even cause your asthma attack. So even as I'm going through the triggers, I want you to, the good thing it's a video, you can pause it, to think about times when you may have been exposed to things like these, and if it resulted in difficulty breathing or wheezing or the tightness of your chest or not being able to sleep. And then you could kind of narrow in on what your triggers are. So apart from environmental, you have drugs. Aspirin to trigger an asthma attack. Also could NSAIDs. NSAID is an acronym for a drug class known as non-steroidal anti-inflammatory drugs, and it covers a large amount of over-the-counter pain medication, pain, fever, inflammation medication. For example, you may have used diclofenac for some toothache or some back pain before, and you realize the morning after you had shortness of breath, or that night you couldn't sleep through the night because it was difficult to breathe. So that would be zooming in on possibly an NSAID causing your asthma attack. So I know you may not have known this before, but even medication can cause an asthma attack. Thirdly, condition. So conditions such as GERD. So GERD is acid reflux. And I cannot tell you, actually up to 84% of persons who have asthma have GERD. 84%. And you may have asthma and you may have problems with acid and not realize that the two conditions are so connected. I'm telling you today, they are. So the foods that you eat that would exacerbate your GERD, like caffeine, alcohol, spicy foods, oily foods, for some persons, even milk and dairy. Whatever food groups you eat that exacerbates your acid, inevitably it's exacerbating an asthma attack. So be careful because there is a connection, right? Also, allergic rhinitis. Persons who usually have allergies may also have asthma, right? And stress. Well, I spoke about stress last week as it pertains to raising your pressure. Stress also could exacerbate your asthma attack. Anxiety, having panic attacks, and viral respiratory diseases, which is what coronavirus is, a viral respiratory disease. And that's why I am encouraging you to be cautious during this time. So, moving on quickly, what are the 4 questions that I want to answer? Because I think these are 4 questions that you may have been asking yourself or asking persons, and you want to know for your safety and for your well being. So, I'm going to answer them today quickly. Question number 1: I have asthma. Is it safe for me to wear a mask? Very important question. Now, initially, what CDC advised was that we not wear masks because of the improper use of masks, and that could have increased the risk of transmitting the coronavirus. But now, what has been discovered, because persons could have the virus and be asymptomatic, as a measure of caution, persons have been encouraged to wear cloth coverings or cloth masks if they're going out in public. Now, once you're putting on your mask properly and you're taking off your mask, not touching the face, because once you touch the face of your mask, that face of your mask would have all your bacteria, virus, dirt that has landed on your mask that didn't enter your nose or your mouth. Once you touch your face of your mask, you contaminate. So once you take off your mask properly, you are fine. Once you wash your mask regularly, if it's a reusable mask, you are fine. What I would advise though, because I am seeing, let me remove my glasses. I am seeing persons wearing masks that are too small for their faces, and therefore the cloth mask, it cuts like the middle of their nose bridge, and they tie it pretty tight, and so you actually restrict airflow. You would have difficulty to breathe if your nose is pressed down like that due to the tying of the mask. So yes, you can wear your mask, but I'll advise you wear the right size and you don't tie it too tightly. And of course, once you realize you're getting difficulty to breathe, remove the mask, take some deep breaths, and make sure that you are okay. Your second question that you may be wanting to know: can I continue using my steroid medication, and would it weaken my immune system? Right, that's a two-part question. So I'm an advocate for patient adherence, so I'm telling you, keep on using your medication as prescribed. Yes, using steroids at a high dose for a long period of time could weaken your immune system, but the risk of you not managing your asthma far outweighs the risk of the prednisolone or any other steroid that you're using weakening your immune system. So unless you go to your doctor, you speak to your doctor and they change your dose or they take you off your medication, please do not decide on your own that you're not going to use your medication, right? Question number 3: should I stop using my nasal sprays? So for some of you, you've been using a nasal spray, and when you insert how you use a nasal spray, you could cause droplets from your nose to spread or to drop, right? And so you may be thinking, that's droplets. Am I causing harm to others? Should I stop, as a cautionary tale? And what I would advise again is do not stop using it. Or what I would recommend is if you could turn away from, say, a crowd of persons and use your nasal spray on the side and then properly sanitize the device. And then your last question, question number 4: can I use my nebulizer at home? Would I put my family at risk? So if you're getting symptoms of coronavirus and it's leading to you having difficulty to breathe, you're an asthma patient, you have a nebulizer at home, you may be inclined to use your nebulizer. Once you have your nebulizing solution at home and you know how to operate your machine, I'm not going to advise against using it. What I would advise though is that you use it in a room by yourself where there's no one else, because when you use a nebulizer, stuff comes out, the vapor comes out, your droplets could be included in that, mixed up in that. So use it in a room by yourself and then sanitize the machine thoroughly after use. So that way you get treatment, your asthma is managed, you don't have to go to accident and emergency. The biggest risk, please remember me saying this, your biggest risk as a patient with asthma is not managing your symptoms at home. You don't want to have to go to casualty. You don't want to have to wait hours. You don't want to have to go through that process and put yourself at risk by going and leaving your home. So you want to stay home and manage your asthma well. Guys, I want to thank you for staying with me today. I hope that the information I shared was easy to understand and that it was beneficial to you. Of course, as I mentioned before, asthma is a huge topic. And if you want me to share on any other aspect of it, just comment below or email me at healthtalktt@gmail.com. I have just given you the building blocks. Please go build a better you.